Cancer viewed through genetic and metabolic perspectives, what research reveals. Many public claims assert that 5-year survival rates haven't improved, but this is misleading. Across various cancers, 5-year survival rates have indeed risen over recent decades. This progress stems from earlier detection, advanced surgery, improved radiotherapy, targeted therapies, and enhanced supportive care. While gains vary by cancer type, stage, and demographics, the overall trend remains positive. Two complementary approaches to understanding cancer biology. First, the somatic mutation genetic model. Cancer develops when cells gather DNA changes that create hallmarks, like continuous growth, evasion of cell death, invasion, and angiogenesis. Modern theories now explicitly consider metabolic reprogramming among these hallmarks, indicating how tumors modify energy pathways to foster growth. Therefore, genetics and metabolism are interconnected, rather than mutually exclusive. Second, the metabolic, mitochondrial perspective. Tumors frequently alter their energy production through a process known as the Warburg effect. This shift increases glucose uptake and glycolysis, even in the presence of oxygen. Such changes are now acknowledged as both a consequence and a contributor to malignant behavior, interacting with genetic and epigenetic changes. What causes many tumors to appear brightly on imaging scans? A common imaging tracer, fluorodeoxyglucose, FDG, is a glucose analog absorbed by numerous cancers. FDG-PET detects this heightened glucose usage, assisting in staging and treatment response where applicable, notwithstanding known limitations and potential false positives, like inflammation. What effectively prevents cancer? Evidence-based strategies. First, quit tobacco and steer clear of secondhand smoke. Tobacco is the most significant avoidable cause of cancer worldwide. Quitting smoking reduces risk over time and enhances outcomes even post-cancer diagnosis. Second, vaccinate against infection-related cancers. HPV vaccination helps prevent cervical cancer and diminishes other HPV-related cancers. Hepatitis B vaccination lowers hepatocellular carcinoma risk. Follow your region's immunization guidelines. Third, maintain a healthy weight, diet, and exercise routine. Engaging in regular physical activity, managing body weight, adopting plant-rich diets, and reducing processed meats can mitigate cancer risks through anti-inflammatory and metabolic mechanisms. Fourth, implement sensible exposure reduction strategies. Shield your skin from ultraviolet radiation. Limit alcohol intake. Reduce exposure to high-risk, occupational and environmental carcinogens, e.g., remediating radon when necessary. Fifth, utilize evidence-based early detection methods. Engage in age and risk-appropriate screenings, like cervical, breast, and colorectal, lung for select heavy smokers, and promptly assess warning symptoms. These practices enhance survival at a population level when executed alongside quality safeguards. In summary, these 5 strategies represent the most significant proven risk reductions for populations when compared to unverified biohacks. Insights on frequently discussed interventions. The evidence indicates vitamin D. Maintaining sufficient vitamin D is crucial for bone and overall health. Yet, large randomized trials like VITAL did not report reductions in overall cancer incidence from routine supplementation in generally healthy adults. Avoid high-dose supplements unless directed by a clinician for specific needs. Ketogenic diets and intermittent, prolonged fasting. Initial research and pilot studies show mixed results. Major oncology guidelines do not recommend ketogenic diets or extensive fasting as cancer treatments outside trial settings. There are significant risks: malnutrition, sarcopenia, interruptions in treatment, especially for those already losing weight. Discuss any major dietary changes with your oncology team. Hyperbaric oxygen therapy, HBOT. HBOT is beneficial for certain complications, like radiation-related tissue injury, but is not an established cancer treatment on its own. Supplements such as AHCC, beta-glucans, colostrum, sulforaphane, methylene blue, and high-dose omega-3. These supplements suggest plausible biological mechanisms with limited or preliminary human evidence in various contexts, yet none are shown to prevent or treat cancer as standalone therapies. They may interact with chemotherapy, immunotherapy, or anticoagulants. Always consult your oncology pharmacist or physician prior to use. Electromagnetic fields, mobile phones, Wi-Fi. Radiofrequency fields were classified by IARC in Group 2B, possibly carcinogenic, in 2011 due to limited evidence. Recent comprehensive reviews, including those commissioned by WHO, have not found links between typical mobile phone usage and brain cancer. Research continues, yet this is not a primary modifiable cancer risk compared to smoking, infections, obesity, alcohol, and UV exposure. Practical next steps. Develop a screening plan. Discuss a personalized screening timeline with your clinician based on your age, gender, family history, and exposures. Early detection is crucial. Establish lifestyle habits. Adopt the Big Four regularly. No tobacco use, active living, weight management, and moderated alcohol consumption, along with skin protection from the sun. Vaccination. Confirm that your HPV and hepatitis B vaccinations are current according to national recommendations. Before starting any supplement or dietary regimen, assess potential drug-nutrient interactions, malnutrition risks, and trial evidence with your oncology team. Medical caution and disclaimer: this content serves an educational purpose and does not constitute medical advice. Cancer represents a unique and complex group of diseases. Avoid starting or stopping any treatment, high-dose supplement, restrictive diet, or prolonged fasting without guidance from a qualified healthcare professional aware of your medical history, diagnosis, and medications. If you experience new symptoms, such as unexplained weight loss, bleeding, new lumps, or persistent pain or cough, seek medical evaluation without delay. Support our channel to spread awareness. Please subscribe, activate notifications, and share to ensure you don't miss an upload.